Hi, Dr. Brian Koffman, a retired family doctor, a CLL patient myself, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm sharing with you some of the papers of interest to patients with chronic lymphocytic leukemia, small lymphocytic lymphoma, that were presented at the American Society of Hematology's annual meeting and exposition held in December of 2021 in Atlanta, Georgia, and virtually. It's also known as ASH 2021. And the paper that I'm going to be presenting now, while not specific to CLL, SLL, is dedicated to increasing the awareness of disparities in outcomes in American blood cancer patients. It's titled, Real-World Disease Burden, Cost and Resource Utilization of Hospital-Based Care Among Mantle Cell Lymphomas, Waldenstrom's macroglobulinemia, marginal zone lymphoma, and chronic lymphocytic leukemia, disparities and risk factors. So what were the takeaways from this paper? Well, the study population was heavily slanted towards the CLL patients. There were 23,952 CLL patients. The next largest group were the mantle cell group at 3,387, the marginal zone 2,655, and there was 1,181 Waldenstrom's patients. All of these, by the way, are related B-cell lymphomas. The use of chemoimmunotherapy was found to be significantly lower in whites compared to non-whites, 11.9% versus 16.2%. Non-white patients tended to have longer lengths of stay in hospital compared with white patients, 18 days in the CLL case versus 14.8 days for the white patients. Across all lymphoma types, higher hospitalization costs were associated with patients who were non-white, who were Hispanic and Latino, who were treated in hospitals in the Northeast or the West, or who had Medicaid. Statistically significant increases of cost was also noted for patients who received targeted therapies or supportive care, such as blood transfusions or expensive growth factors. So what conclusions can we draw from this? Well, there's a lot of data here, and it's all mixed together. But the real-world data does demonstrate significantly high medical costs for patients with CLL, SLL, and lymphoma once they're hospitalized. And this has a significantly higher impact in minority populations. Better outpatient care and wider use of novel oral targeted agents might go a long way in decreasing expensive hospitalization and reducing the disparity in care. The CLL Society is pleased to see that this kind of research is ongoing and being presented at the major hematology conferences.